Good afternoon, everyone. I'm Dr. Sugandha Agarwal, reader in Department of Public Health Dentistry. We'll be going to take a lecture on occupational hazards in dentistry. So, coming to the introduction, it can be defined as a risk to a person usually arising of employment. It can also refer to a work material, substance, process, or situation that predisposes or itself causes accidents or disease at a workplace. History. Bernardino Ramzani, also known as the father of occupational hazard. Working dental practitioners are exposed to a number of work related hazards, like working at a high level or concentration of long hours is a kind of occupational hazard. Working with anxious patient. Exposure to micro aerosol generated by high speed rotary handpiece. Exposure to various chemicals used in a clinic by a dentist. Hazards in dentistry. First is biological health hazards, physical hazards, chemical hazards, mucoskeletal disorder, and the disease of peripheral nervous system, radiation exposure, and other risks. Coming to biological health hazards, these hazards are constituted by infectious agents of human origin and include plants, virus, bacteria, and fungi. Infections such as hepatitis B, HIV, and other types of communicable infections are at a high risk of transmission from patient to doctor. Modes of transmission. These viral agents are easily detected to body fluids as such as saliva and blood. They can be transmitted directly or indirectly. Directly, when the doctors come directly in contact with the infectious fluid, epidermis of hand, that is, microorganism can pass into an individual through a cut on a skin of hand and subsequent contact with the infectious fluid. Result of an accident bite or by the patient. Indirectly, source includes gingival fluid, natural organic dust particles mixed with air and water. Come in contact with infectious needle through respiration of aerosol particles by nasal epithelium, epithelium of upper airway tract, bronchial tube epithelium, epithelium of alveoli, conjunctival epithelium through coming in contact with infectious needle or other objects, puncture wounds, lacerations on the epithelium. Coming to transmissible disease or agent versus viral disease, that is AIDS, HIV, hepatitis, herpes. Bacterial agents are like tuberculosis, that is Mycobacterium tuberculosis, Staphylococcus aureus, Corynebacterium diphtheria. Carriers of these agents may be asymptomatic. Thus, proper preventive steps should be considered. How the prevention and the management can be taken. In general, workers should be aware of potential hazards. Proper medical history of the patient should be taken. Worker education, awareness about the disease. After taking the history and the treatment, you have to give the awareness about the disease to the patient. Use of barrier techniques by using gloves. You should always wear the gloves, mouth mask, eye wear, very important, face shields and high power suction. Proper disinfection techniques should be followed, like proper water disposal, equipments to provide minimal aerosols, maintenance of proper ventilations. While dealing with a high-risk patient, you should do identify high-risk patient, use of double mask, double glove technique of high-risk patients. Patient should be given the last appointment. Always the patient has to be given given the last appointment who is at the high risk, so that other patient can't be affected. The patient practitioner with an laceration or cuts on the epidermis of hand should be prohibited from attending the operative procedures. Proper disinfection technique and proper disposal. If the practitioner, if the dentist have any cut or laceration on the epidermis on the hand, he should be prohibited from attending the operative procedure of the high-risk patients. So the prevention is better than cure. Proper immunization of the worker should be done. It is very important. So the golden rule, all patients should be treated as if they are infectious, and routine cross-infection control is necessary dealing with every patient. Coming to physical hazards, dentists are at a high risk of physical injuries during treatment. Use of sharp may cause physical injuries to the practitioners. Debris from oral cavity might strike the eye. Cut from the sharp instruments puncture wounds from the needles and sharp objects. Percutaneous exposure incident, that is PEI, broad descriptive term that includes sharp injuries as well as cutaneous and mucous exposure to blood and serum. Prevention and management in this proper storage of sharp instruments. The storage of sharp instrument should be proper. It should not be kept here and there so that it cannot be hurt to any other person. Equipment maintenance, proper managing and handling of the sharp instruments, carefully carried out procedure. Needle stick injury. Ensuring the needle and the surgical blade are sheathed and or covered when not in use. Always when the needle is used, it should be covered. It should not be kept open so that it cannot be touched by any of the patient. Keeping full control of sharp instruments, retaining full concentration while handling such instruments. Keeping the gloves finger behind the cutting edge of the surgical blades and elevators or the points of probe or needle. Adequate retraction of tissue and appropriate instruments, placing needles in sharp, safe box, taking care when cleaning away the surgical sharps, wires, etc. What overgloving or using double gloves whenever indicated. Post-accidental management. Chemoprophylaxis is very important. You should remove the gloves. Wash the site of injury under running water with the soap or water. Avoid scrubbing and encourage bleeding and then protect. Usually, it is necessary to take blood specimen of both the patients and the injury patient and test it for HIV. If the patient is seropositive for HIV, the healthcare worker should be counseled about the risk of the infections and evaluated clinically and serologically as soon as possible after exposure. A baseline HIV test should be carried out immediately. Advised to report and seek medical evaluation for any febrile illness that may occur within the 12 weeks of the exposure. HIV test should then be repeated approximately 6 to 12 weeks after contamination. Advised to follow the recommendation of preventing transmission of infection. During this period, advice from the HIV counselor is of utmost importance regarding domestic relation procedure at workplace. Practitioners should immediately evaluate by a physician. Now coming to chemical hazards, chemical and substance used in dental clinic poses a major hazards to dental practitioners. Amalgam used in dentistry contain mercury, which is a highly toxic metal, may lead to mercury poisoning. Direct contribute chemicals such as eugenol, phenol, iodine, formalin, some impression materials, topical anesthesia can cause adverse reaction in the practitioners like contact dermatitis. Latex hypersensitivity, many of the cases are there, very common. Prevention and management, proper education for the workers, developing safe work procedure, substitution of harmful products with the less harmful products. Example, latex gloves can be substituted by vinyl gloves or use of dust-free alginate. Monitor leakage or spillage of any potentially hazardous substance. Proper storage products, medical monitoring of workers periodically. Drilling safe. Use of water spray with the velocity execution and rubber dam to reduce exposure. Dental staff should wear face masks. Carpenting and rugs should be avoided as it is a major repository for the mercury. Never rinse elemental mercury down the drain. Never dispose elemental mercury in the trash. Never dispose elemental mercury in the sharp container or a medical waste. Keep the filling cool during the removal. Cutting the amalgam into the chunks while drilling into the amalgam, making sure only chunks of amalgam is cut and the later is then removed by the hand instrument. This results in less formation of aerosol. Management of water, proper water disposal. Categories of biomedical waste. It is very important. Category 1, human anatomical waste. 2 is animal waste. 3, microbiology and biotechnology waste. 4, waste sharp. 5 is discarded medicines and cytotoxic drugs. 6 is soil waste. 7, solid waste. 8 is liquid waste. 9, incineration ash. And 10 is chemical waste. So this is the chart that shows the color, type of container, category, and waste treatment. The yellow one, in the yellow container, we will use the plastic yellow plastic bags. This is 1, 2, 3, 6 category. And this incineration of the deep burial is given. In red, plastic bag 3, 6, and 7, autoclaving, microwaving, and chemical treatment. And after that, the blue, white plastic bags, and last is the black. Segregation of waste in the color coded bags. These are the color coded bags. One is yellow, red, blue bags, and black. Yellow bags in this infectious waste, bandage, gauges, cotton, or any other things in the contact with the body fluids, human body parts, and placenta are disposed. In red bags, plastic waste such as catheters, inject irons, syringes, tubings, IV bottles are disposed. Blue bags, all the types of glass bottles and broken glass articles, outdated and discarded medicines. Black cardboard, needles without syringes, blades, sharps, and all metal articles are disposed. Now coming to mucoskeletal disorder, dental surgeons are normally included in the group of professionals at a high risk of suffering from MSTs, pain in neck, shoulder and other extremities due to the strained posture of dentists at work with the neck bend and twisted repeated movement of hand can cause neck syndrome and pain in the upper extremities and the shoulders. Dental surgeons are exposed to various kinds of MST, that is tendonitis, bursitis and synovitis. So why MSDs are common in dentistry? There's a repetitive motions like scaling and polishing, static neck, back and shoulder position, grasping small instruments for prolonged period, and prolonged use of vibrating hand tools. Prevention. The key to prevent work and related MSD is ergonomics. So what is ergonomics? It is the science dealing with designing of a workplace, equipments and the surroundings to ensure comfort and efficiency for the practitioner. Dental chairs should be adjusted in a manner that the position of the doctor is neutral and muscles are relaxed. Instrument design, the handle should be thicker, round and hollow. Radiation exposure in dentistry, low level of radiation is used, which causes few cell damage, but even low level of radiation exposure over a prolonged period of time may cause potential hazards to the health. X-ray is an ionizing radiation that is capable of initiating and producing damage to body cells as well as carcinogenic and genetic change. So there is radiation dermatitis on hand and squamous of cell carcinoma on the figures. So prevention, proper principles should be followed while taking in an X-ray. Dentist should not hold the film in the patient's mouth. Proper technique and ensure correct X-ray. Thus, repetition is avoided. High quality film should be used as they ensure good quality image. Workplace should be properly designed. Appropriate shielding, that is use of lead apron, equipment designed to minimize scatter. A replacement of older X-ray equipments, monitoring the exposure, proper education of workers, and periodic screening. So these are the other risks under their management. Other risks are psychological hazards and abuse by the clients. And these are the managements in the table. So what is technostress? Negative psychological link between the people and the introduction of new ideas. People experience technostress when they are unable to adapt or cope up with the information technology in healthy manner. That is, causes of technostress are quick pace of technological change, lack of proper training, and increased workload, and lack of standardization within the technology and lack of technical support. So how you can cope up with the technostress? Cultivation of flexible and continuous learning education, buying more adequate equipment, create better communication, create a level of reassurance, patience, and stability within the environment. So this is all about the occupational hazards. Thank you.